So, ladies and gentlemen, dear colleagues and friends, it is my pleasure to welcome you today in Bonn to the conference Displacements Induced by El-Niño, a public health issue. This event has been organized by the Centre Virchow-Villermé for Public Health Paris-Berlin, the Hugo Observatory, and the University of Geneva, in partnership with the Lancet Countdown Initiative, the World Health Organization, ELG, Université, and Charité Universität Medizin. Following up on the recent publication of the report on climate change and health by the Lancet Countdown Initiative, we are happy to organize this side event, which seeks to connect the migration and health issues that are associated with El Niño oscillations. The number of forced migrants in the world remains unprecedented, and an increasing number of those are forced from their homes as a result of climate change. This raises specific issues for public health scholars and practitioners, and this is the reason why we believe it is important to connect the issues of health, migration, and climate change together. As the recent report from the Lancet Countdown has shown, climate change has very serious impacts on human health. In parallel, natural disasters and gradual environmental processes such as the El Niño phenomenon continue to displace millions internally and across borders, potentially contributing directly or indirectly to migration crises unfolding in different regions of the world. For all these reasons, health deserves to be placed ever closer to the center of the agenda of combating climate change. So how did El Niño emerge as a society issue and a health problem? El Niño events have occurred for millennia, but were probably first recognized in the late 19th century in Peru. El Niño events in 1982-83 and in 1997-98, the most recent, were the largest this century. Michael Glantz, in his book Currents of Change, El Niño's Impact on Climate and Society, draws upon the infamous 1982-83 El Niño, the mother of all El Niño, as an example of an anomaly. The timing and location of its onset differed from those of previous El Niños. Thus, it was not expected by most climatologists, and the 1982-83 El Niño was also unparalleled in the range of magnitude of its ecological and economic impacts. Also, it was the first El Niño to capture the attention of the media and the public simply by virtue of its massive global impacts. Glantz argues that this particular event is becoming overused as an example of typical El Niño-related devastation. Indeed, the 1972-73 event, the forgotten El Niño, was the one that sparked scientific interest and eventually led to operational forecast models. What is indeed is not a continued provision of generic information about El Niño, but rather a retailing of concrete information tailored to the decision-making and adaptation needs of specific stakeholders. As El-Niño will deeply affected by climate change, the associated migration and health issues are likely to become increasingly connected. Yet, those two crucial human dimensions of climate change remain insufficiently connected, and the side event will explore how they can be addressed through meaningful policy responses. The El Niño Southern Oscillation is a main driver of global interannual weather variation, occurring every 3 or 7 years, 2 to 7 years. The ENSO phenomenon leads to extreme worldwide weather events such as heavy flooding or drought. The irregular occurrence of El Niño and La Niña events has implications for public health. There is a growing concern that severe weather changes resulting from El Niño episodes and global climate change directly affect human health. The ENSO provides health researchers with an opportunity to model effects of local climate anomalies on infectious disease dynamics. On a global scale, the human effect of natural disaster increases during El Niño. The effect of ENSO on cholera risk in Bangladesh and malaria epidemics in part of South Asia and South America has been well established. The number of people killed, injured, or made homeless by natural disasters is increasing alarmingly. Diarrheal illnesses are among the highest disease burden in children younger than 5 years of age worldwide and are predicted to increase with climate change. The El Niño cycle is linked with increased risk of some of the disease transmitted by mosquitoes such as malaria, dengue, or Rift Valley fever. Malaria transmission is particularly sensitive to weather conditions. In areas where El Niño can reliably be associated with regional or local climate variations, such as drought and flood, El Niño forecast can provide decision makers with the earliest possible warning of an increased risk of such adverse climate conditions. Thank you. Seasonal forecasts have already been included into many local and regional famine and drought early warning systems. The need to define predictive factors on which to base forecasts of epidemic risk is an enormous challenge for public health agencies working at the central and local level. Preparedness for epidemic is one of the focal points of World Health Organization rollback malaria program. Health planners are using the dealing with a special risk concept, but there is a lack of experience with temporal risk management. El Niño remains, however, difficult to grasp as a driver of migration and displacement, as it translates into a wide variety of impacts, floods, drought, etc. The displacements associated with such impact will lead to significant health issues. Also, there is a wide understanding that both migrants' health and climate-induced migration are major challenges of our time. Only few attempts have been made to consider the complex relationships that unite climate change, migration and health together is an integrated three-pronged nexus. This is the reason why we feel there is a pressing need to connect health, migration, and climate change together. Hopefully, this side event can be a meaningful step in this direction. There is an urgent need for research and transdisciplinary cooperation in order to address the challenges. The commitment of all stakeholders, including researchers and policymakers, is necessary to develop strategies and responses. Today's side event provides an appropriate platform in this respect, bringing together scientists, experts of the fields, and public authorities. So I would like to thank all invited speakers for their contributions and all participants for attending this event. Let me also thank those who will join us remotely, Antoine Flahault from Geneva and Joachim Röckler from Sweden. I thank you for your attention, and I'm giving the floor to Tara Neville, so from the World Health Organization, in charge of this session. Thank you.
Thank you. Well, I have the privilege to introduce our esteemed panelists today, so I'm very happy to be here to do that. Just to let you know, we'll go through all of the presentations and then we'll have 15 to 20 minutes of questions. So to begin with, we have a presentation by Professor Antoine Flahault. He's the director of the Institute of Global Health at the University of Geneva. Now, unfortunately, he can't be here. He's not present today. However, he has sent his presentation on El-Niño and southern oscillations and infectious diseases. And this consists of 2 short videos, which we're going to use in order to kind of commence the discussion. So if I can just request that we start video number 1, which is on climate change and vector-borne diseases, and just direct your attention over to the screen.
I would like to talk also about the viral disease. It is a bit complex because some mosquitoes are prone to proliferate when there is drought and heat waves. Usually, we do believe that the mosquitoes prefer the water and proliferate when there are some flooding, some heavy rains. It is true for malaria, it is true for other mosquitoes. Anopheles like heavy rains, for sure. But what about Aedes aegypti or Aedes albopictus? Usually, Aedes albopictus or Aedes aegypti proliferate when there are drought and heat waves. Why? It is just because the people are collecting the water maybe farther than usual, and they store it near the house where the mosquito like to be, because he may bite the humans, may bite some vertebrates to get the supplement of proteins they need for their eggs. So it is the reason why usually these mosquitoes are proliferating when there are heat waves and drought. If there is any viruses which are transmitted by these mosquitoes, such as the dengue viruses or the chikungunya viruses or the Zika viruses or the yellow fever viruses, here the mosquito will bite people and infect people due to these viruses. And the mosquito will infect themselves and the outbreak may emerge. So there is a reason why this disease may emerge. It is when there are drought and heat waves. And these drought and heat waves are often facilitated by El-Niño or La Niña events. So when there is a huge El-Niño event, exactly as we knew in 2015 when the Zika epidemic emerged in northeast Brazil, one of the reasons may be explained by this El-Niño event, because there was a heat wave and a drought at this part of the world in northeast Brazil. We have seen the same kind of momentum during a La Nina event in the Horn of Africa, where there is also heat waves and really drought during this La Nina event in this part of the world. So in various parts of the world, you may have various climate patterns which are prone to the emergence of this kind of vector-borne disease. And we have to know that there is an assumption today to say that El-Niño and La Nina events are more often more frequent and also more severe due to the climate change. It is debated, but if it is the case, what we may foresee is a kind of multiplication in intensity, in frequency of this vector-borne disease, of emerging vector-borne disease outbreak in the world.
And we have a second video on diarrhea and influenza. If we could start that video now.
I would like to talk about two frequent diseases which are also subject to an impact of the climate: diarrhea and influenza. What about diarrhea? Diarrheas have multiple forms. Cholera is one of the major forms of an acute diarrhea, and cholera may occur when there are flooding or heavy rains, which are very well linked with climate, and so with climate change. But I would like to talk about something which is probably less known, which is the acute diarrhea in children in sub-Saharan Africa, which is due to drought and to heat waves. It has been seen clearly that each time the rainfall decreases by 10 millimeters, there is an increase of 4% in acute diarrhea in children below 5 years. The reason why is not very well known. It has been said that maybe when the rainfall are decreasing, there are, of course, shortage of water, and this shortage in water may lead to a lack of hygiene in parents and in children. Washing your hands is less frequent, less easy because of this lack of water, and due to that, the contaminated foods and maybe the acute diarrhea may occur in outbreaks. And this is a leading cause of death in children in Africa. So due to climate change, we may fear that there will be an increase in this infant mortality, in this children mortality due to acute diarrhea. What about influenza? Influenza is a quite different story. Influenza, we know, occur in many countries, not only in temperate zone, but in our temperate countries, influenza may lead to a lot of deaths, particularly in the vulnerable segment of the population. And influenza has been seen to be associated statistically with the cold oscillation in South Pacific. When there will be this La Nina oscillation in South Pacific, larger epidemics will be seen with higher severity, higher mortality, particularly in the elderly, and also larger size of the epidemics in the northern hemisphere, in the USA or in Europe. The reason why is not explained, but what can be assumed is that if, due to climate change, these La Nina events are more frequent and more severe, we will experience more severe and larger epidemics of influenza in our countries. It has also been seen that the pandemic influenza, meaning these new strains of influenza, the last one was in 2009. We know, maybe we remember the Spanish flu in 1918. These huge pandemics are also occurring more often during La Nina outbreaks, La Nina events. So when there is a La Nina event, the risk of a pandemic is increased also. So if the climate change increase the severity and the frequency of La Niña events, we may experience in the future more often pandemic influenza.
Well, we'd like to thank Dr. Flahault for joining us by video presentation and for these thoughts on infectious disease and relationships with ENZO, and particularly in vulnerable populations. Next, we have a presentation by Dr. François Gemenne. He's the director of the Hugo Observatory at the University of Liège, and he'll be speaking to us today about the topic is a threesome is healthier than love triangles. So connecting planetary health, climate change, and migration. So that should pique everyone's interest to his presentation. So I welcome you to the floor.
Thank you very much. Shall I speak from my seat or from the lectern? Well, good afternoon, everyone. Thank you very much for the introduction. Thanks for having me on the panel. Today, I'd like to speak about the need to better integrate the concerns we have regarding health, climate change, and migration. And it seems to me that over the last few years, we've seen the emergence of three distinct nexuses, all crucial to the matter, but all insufficiently connected to each other. First, obviously, there have been a lot of policy developments regarding the role of climate change as a driver of migration and displacement. Clearly, if we only judge by the number of side events taking place here at COP23, this is clearly an issue that has gained a lot of traction, and it seems to me that governments across the world, international organizations, civil society organizations, are becoming increasingly aware that climate change is now a leading driver of migration and displacement, and some measures have been taken. Some policy developments have taken place to address this all across the world and not just at the international level, and this is good. At the same time, there is a second nexus that has emerged, and this nexus connects public health with climate change. I'm not myself a public health specialist, but I guess it is fair to say that it has taken a long time for the public health community to realize the health impacts of climate change, and we now see that the public health community is going full speed, full steam on this issue. You might have seen a few weeks ago the publication of a special report of the Lancet journal called The Lancet Countdown on planetary health. So clearly, the health community is realizing that a major impediment to the progress of public health worldwide will be climate change, and we've just heard some of the impacts that climate change will provoke on health. So this is nexus number 2, climate change and health. Nexus number 3 connects migration and public health, especially since the beginning of the so-called refugee crisis in Europe in the summer of 2015, the health of migrants has become a key policy priority. Most of the NGOs that are active today in refugee camps or in boats in the Mediterranean are medical NGOs, be it Doctors Without Borders or Doctors of the World. Even if we look, at least in Europe, if we look at the makeshift camps in the capitals, again, these are medical organizations and NGOs in charge of welcoming asylum seekers and refugees and providing them with assistance. And there are now a number of initiatives and policy processes that seek to improve the health of the migrants. And this is also very good. The problem is that these three nexuses are very much working independently from each other. Each of them is producing its own policy instruments, its own policy developments, its own initiatives, and sometimes I have to say that they work in clusters without acknowledging what is being done in the other constituencies. And yet, there are many points of junction between these three nexuses that are neglected. The result of this insufficient connection between the three nexuses is that I'm afraid these can lead to very counterproductive results and policy directions. I'd just like to take one of them as an example. There is at the moment, in the climate negotiations, a key emphasis that is put on the role of migration as an adaptation strategy. Migration is actively promoted as a way for people and communities to adapt. It's been recognized as this since the Cancun Adaptation Framework in 2010. And clearly, there are many works and many reports that highlight that rather than being a failure of adaptation, migration can indeed provide resources that will help communities adapt to the environmental threats that they're facing. Yet, on the other hand, there are also intergovernmental negotiation processes on migration. And very often the key purposes of these processes, be they international or regional, if one takes the recent summit between European and African heads of states, the key purpose of those negotiation processes is to limit or to slow down migration and to find ways so that people would move less instead of moving more. And therefore, if one looks at the climate negotiations, we'll try to develop instruments that will push people to migrate in order to adapt to environmental changes, and migration will be promoted, encouraged, facilitated, enabled, and even funded. And on the other hand, if you look at the negotiation processes on migration, migration will be discouraged, disabled, and certainly the key priority will be to limit and slow down migration. So even in the absence of any political judgment of where we should be heading, one can see an obvious contradiction between these two policy processes. And each of them is, of course, absolutely convinced that it goes in the right direction and that significant progress has been made and achieved. I think connected to processes, including multilateral negotiation processes that happen outside of these rooms, that happen outside of the COPs. Also, we need to be more in touch with the civil society and those who are the first local responders to these issues. It seems that there is a disconnection between the progress that we're able to make in international fora and the really limited progress that we're making on the ground. And I think that one of the reasons for this is that we sometimes remain too much enclosed in the COP bubble and not enough connected with the local responders, with the organizations and the local policymakers, not the international policymakers, the local policymakers who are responding to these issues on the ground. The result, I think, is that there are many good initiatives, but that these initiatives are not yet unleashing their full potential because of these insufficient connections between them and with the civil society and local responders. I'd just like to address two of these initiatives that I think would unleash much more potential if they were more connected between them and with the release in the field. The first one is the Global Compact on Migration. In September 2016, the UN General Assembly convened a major emergency meeting on the so-called refugee crisis with the goal to try and to stem an attempt at a multilateral governance process of migration. It was the very first time that governments actually agreed to discuss on some idea of a global governance of migration. This is something that had been called for by the research community and by NGOs for years and years, and finally it did materialize at the UN General Assembly. And as a matter of fact, the negotiations of the Global Compact on Migration have addressed the role of climate change and the role of disasters as drivers of migration. Last May in New York, a specific negotiation session was dedicated to this issue. The problem is that, and this is certainly not to blame them, but this session was attended by very few environmental NGOs. the usual suspects that you see here in the COPs, the Greenpeace, WWF, Climate Action Network, and so on and so forth. And I bet that some of you are members of these organizations who do excellent work here. But they were not at this negotiation session in New York. And yet, they would have had a lot to say. They would have had a lot to say to policymakers, to migration policymakers, about the role of climate change and disasters as drivers of migration and displacement. And I believe that these NGOs and that these voices were not there simply because they didn't consider that it was their place to be there, simply because they considered that it was a distinct process where maybe there was no room for them. The same can be said for governments of vulnerable countries. I mean, most of the governments who took the floor in this negotiation session were governments from industrialized countries. All EU countries, the US, Japan, Australia, you name them, all of them had something to say about it. But when it came to African governments or to Asian governments, many of them didn't take the floor, and I guess because they felt that it was not their role to do so in that specific session. And therefore, there is a kind of discrepancy between the state of our discussion on these issues in forums like this and the state of discussion on this issue at the negotiation of the Global Compact on Migration. And yet, at the end of the day, when it will come to migration governance, the negotiations on the Global Compact of Migration most likely will prevail over everything that we're discussing in these rooms. The other example that I'd like to take, and I will conclude here, is related to the task force on displacement. A major achievement of the Paris Agreement at COP21 was the creation of this task force that would provide key recommendations and good practices to states in how to address displacement induced by disasters and climate change. The problem is that if you look at the composition of this task force, you basically get the very same organizations that take the floor here in these rooms. I was in the early afternoon attending the One UN event with all UN organizations active in this field, and I was kind of struck to see that these were basically the same people who were also sitting in the task force. And I kept wondering, what's the point of creating a specific ad hoc task force if you take exactly the same people as those who are already working on the subject within the realm of the climate negotiations? And I think that we're wasting an opportunity to open the task force to other communities, to other constituencies, to other people who work on these issues of migration, climate change, and health, but who are not usually present in these negotiations. And I think that a kind of common challenge for our community, and I certainly include myself in that, is to reach out to other constituencies and to realize that we are no longer the only ones to discuss climate change and its human impacts. And this is for the better. I think this is a very welcome development that other constituencies, that other communities are also addressing these human impacts of climate change. But we need to realize that there are other fundamental discussions on these issues that are taking place outside of the COP. And we absolutely need to reach out to them, because if we don't do so, any progress that we can make in these rooms or in the Bula zone over there will become meaningless on the field, because it will not be matched with similar progress in other negotiation processes, in other multilateral forums, at the global level, but also at the local level. And this is really what I wanted to say today. Thank you.
Thank you, Dr. Gemenne, for that really convincing argument as to the importance of connectivity in dealing with climate change, health, and migration, and the potential pitfalls we may face if we don't take advantage of those opportunities. So we thank you for your presentation. And with that, we'd like to invite Dr. Carolyn Ziegraaf to present for us. Dr. Carolyn is the Deputy Director of the Hugo Observatory from the University of Liège, and she's going to speak to us today about climate change, health, and human immobility, regional evidence of the impacts of El-Niño. So, thank you.
Thank you. I see that already that my slides are distorted, so hopefully they're of use. So today I wanted to kind of take a step more towards the empirical side of El-Niño's impacts on human migration, displacement, but also multiple forms of human mobility. And being that we have experts in specific regions, particularly Africa, I thought I would try to give a more global picture. So. Voila. So in terms of linking climate change, El Niño, environmental change to human mobility and to health, what was trying to think of how to present this work, it was such an extreme challenge because there are so many links that to narrow it down, I find quite difficult because human mobility linked to environmental change comes in so many different forms. We commonly talk about displacement, and I think that that's a normal association to make, particularly when we know the disaster displacement numbers that are frequently cited coming out of IDMC, that one person is displaced by a disaster every second on average. But as François has gestured, we also have migration as adaptation. So migration is a preemptive response to environmental change, as well as other factors, or a reactive, more voluntary. I never like to say the strict binary between voluntary and involuntary, but also assisted or forced relocation or resettlement programs, as well as immobility. So the fact that not everyone moves and not everyone can move, and even the people that can move are often constrained in that mobility. So this is also a type of immobility. People being stuck in transit, for example, we see in North Africa, people coming from sub-Saharan Africa. So we began this conversation last year in COP22, how to connect human mobility, climate change, and health. And I welcome this opportunity to kind of narrow in on something more particular so we can kind of dig deeper, and that being El Niño. So El Niño is this one lens in which, just one lens in which we can see how people's movements connect to human health. And of course, there being no single link. So it's not just, of course, that people move because there are health risks, or people move and arrive bringing health problems with them, or facing health problems in destination areas, particularly like coastal megacities, living in floodplains where there's cholera outbreaks, for example. But so one of the links to make, I think, with health that's really important from a more global perspective to me, rather than picking a specific disease or epidemic or pandemic, is the idea of food security and malnutrition. And I think that's something that speaks a little more broadly to my work and my research in migration for a few different reasons. Okay. One is because there's quite obvious and direct links to El Niño, the malnutrition and food security being a huge impact of El Niño, which is both produced in some part migration, but also been the outcome. And then also because, again, it speaks to a lot of different forms of mobility. I think when we consider food security and malnutrition as a result of that, we can see displacement, we can see more preemptive migration acts or behaviors, and particularly through the economic pathway. So we talk a lot about sustainable livelihoods, and when food security is happening, a lot of time that's linked to economic livelihoods. And so people move when their livelihoods are no longer manageable, or at least a part of the household might move in order to have some other source of income. And then, of course, disaster displacement, which we can connect in various ways to food security and malnutrition. Not just that a disaster occurs, people are displaced, people also suffer from malnutrition, but often the places they're displaced to may still be in the disaster zone, or camps and shelters that are facing food scarcity and water scarcity and malnutrition. And then thirdly, I think this is an important link, again, because of the geographical relevance. Picking a specific disease certainly narrows our focus just to certain areas, certain countries, and certain regions. But I think this is one way in which we can see more broadly some links between El-Niño and other environmental changes as well, and multiple regions of the world, and how also these might affect in the future. So, of course, El-Niño's some of the primary impacts of El-Niño, we can say La Niña as well, include climate-sensitive sectors such as agriculture. So this is why we need to, again, connect things like food security and malnutrition to economic livelihoods and not just displacement, but also other forms of migration, because people are very vulnerable who are dependent on their resources. And if you have agriculture suffering, it's not just the disaster happens and now there's no food, but there's also, you cannot, after, and even in slow onset events, slow onset changes, soil salinization, for example, or droughts, this takes a slow toll on your way to, your ability to feed yourself, and also increases dependence on buying foods and food prices, which were also impacted by El Niño. And secondly, key sites are mainly in developing countries. So when we look at the impacts of El Niño on migration and health, most of these places are in developing countries. And I think that that's really important to remember, both of these things, because I don't think that they can be underestimated. I think we kind of throw those out when we talk about climate change more broadly. But I think when we are talking about migration and how we really have to remember that these things are happening. People don't just move or aren't just malnourished because El Niño happened. We have to consider who and where these people are and why they were either displaced or why those people moved and not others. So again, a hazard isn't a disaster, right? A disaster has to adversely affect human communities. So this brings in policies on disaster risk reduction, policies on climate change, policies on migration. So I wanted to just briefly touch on a few bits of information, evidence coming from different regions. Again, we're going to have several speakers who are focusing on some of the most affected regions of the world, being East Africa. But in Latin America, we had 150,000 people were displaced between 2015 and 2016 by flooding in Argentina, Brazil, Paraguay, and Uruguay. We had 3.5 million people in Honduras, Guatemala, and El Salvador who were facing food insecurity during the summer of 2016. And again, if we take a step back towards agricultural pathways and livelihoods, we look at who are the people living in the dry corridor of Central America, which was heavily affected. These are primarily subsistence farmers, laborers, landless farmers, and female-headed households. So these people are particularly vulnerable to climate change, but specifically to environmental change, as well as health impacts of these things. So we saw that displacement and migration, I don't really want to make that exact parallel, but that multiple forms of migration occurred in this region, primarily, again, internally, which is why I think it is really important how that François mentioned working with not just international policymakers, but national policymakers. In Africa, I will avoid speaking of East Africa, but we saw that 6 countries in Southern Africa found an increase in migration because of this lack of food and water during the El Niño-induced drought from 2015-2016. In Lesotho, poor crop production and high staple prices due to drought meant that many of the poorest, the poor and the very poor households were facing huge amounts of food insecurity and malnutrition. And then the income decrease from this crop production, and because they're spending so much money on staple prices, on buying food, led to a lot of migration to South Africa, but for labor opportunities. So again, a lot of times when we're talking about these links between environment and migration, we're talking also about economic migration. And displacement often gets, I think, the highlight because it's much more I don't know, sexy if I'm gonna, like your title, which was much sexier than mine, but displacement is much catchier and it's easier to count than this kind of movement and labeling it environmental migration or El-Niño migration. And then in other African countries, we saw pastoralists that were particularly affected because human mobility is intimately tied to livestock mobility. So if livestock moves or needs to move because of food scarcity or water scarcity, often we also have pastoralists being obliged to move or, in the reverse, being stopped from movement. Just a couple examples in Asia Pacific. So Cyclone Winston, when it hit in February of 2016, already hit an extremely vulnerable population. And that was because this population was already facing water scarcity and drought, which were largely caused by El Niño, of course, not ignoring other politics and policies about water management, but disaster strikes, and these people are vulnerable because of things like El Niño as well, and other environmental things that interact with other forms of climate change and other natural disasters. And we saw 62,000 people were displaced, many whom are still displaced. So again, connecting the dots between not just looking at El Niño, but looking how something like El Niño amplifies vulnerability to other disasters and other forms of environmental deterioration or degradation. In Papua New Guinea, the drought starting in 2015 was the worst in the country since the 1990s. 1.5 million people were affected, and 226,000 faced severe food shortages as of last summer. So many of these people were forced to move. So again, displacement as well as migration. But I wanted to kind of conclude by drawing it back out into what I think is kind of I believe is a very important link, and one that doesn't get enough attention because I think it's quite invisible. It maybe is part of the reason we have such separation between discussions about health or migration, is because of this other form of human mobility that interacts with environmental changes is immobility. So many of the people who are the most vulnerable to health risks of El Niño are those that do not move. So the people who are not able to leave these areas that are either affected by droughts or floods or other natural disasters that cannot get away. So these are often the people who are most at risk of food scarcity and malnutrition and all of these other diseases that we see. For example, in my work in Comoros and in the Indian Ocean, the people who are suffering from typhoid and cholera and diarrhea were the people who were not migrants. So the people who are migrating were able to escape a lot of these health concerns, but also able to assist their families in avoiding a lot of these health risks. And so this immobility, this inability to move or unwillingness to move, I don't want to suggest that all people who stay want to move, does have a really intimate connection with health risks. So I think that, and this is I'm not the first one to say, but there are people who are unable to move or unwilling, and they present a massive policy concern as well that I don't think should be excluded from these discussions about human migration and health and climate change and El Niño. And again, because of as well of this double vulnerability, the fact that often when things like El Niño happen, they deteriorate the resources that people would normally use to move. So you're not only more vulnerable to health risks and El Niño and climate change, but you're also less able to move away from them, especially as they deteriorate your livelihood sources and your assets. And again, so I just think making this connection outside of especially the idea that migrants bring disease. So there's so many links that we can make here, and that's just one angle that I would like to highlight, that we're not continuing to reinforce this idea of typhoid Mary, that migrants are vectors themselves of disease, but actually seeing how, again, if we take a migration as adaptation lens, that it can be actually the inverse. So thank you very much.
Thanks, Dr. Zygeraff. Thanks for sharing with us some of the complexities of mobility as it relates to El Niño and health, and we certainly appreciate the regional examples that you shared and the devastating impacts associated. So at this time, I'd like to move on to Dr. Pierre Auzet. He is the scientific coordinator of the Hugo Observatory at the University of Liège, and he's going to speak to us today about displacements in public health in the context of building exposure to risk.
Thank you. Well, okay, we've we had a lot of words. I'm just going to show pictures. And the pictures, I have a few keywords. Celerity, vulnerability, maladaptation, poverty, and lack of urban planning. So I'm going to just show a few case studies. Caroline just talked about Eastern Africa, and my colleague just after, Mr. Mansour Dessi, will talk about Ethiopia. This is what is going on in Djibouti, which is quite close to it. And as you can see, over the last years, the rainfall deficit has been huge. And what happens over here is that many people are displaced and they are leaving the rural areas, but also countries like northern Ethiopia, Eritrea, and the Somaliland, in order to find a refuge in Djibouti city. And the thing is that they are located in the wadis. So if it rains over there, people will be just erased and will die of it, because they are within the river, which is dry all over the year, almost, except when it rains. So people are just escaping drought, and they may die of flood. But let's go back to what's going on right now. So we are in 2017, and we see that close to 30% of the population of Djibouti is under huge stress. And the thing is that we have a new famine starting over there, and we would like to see how it is translated in terms of displacement. This is an area in June of this year that was totally free of anyone. Nobody was living there. It's just in the suburb of Djibouti city, okay? You see the scale over there? So this area is more or less the size of 100 football fields, all right? So this is in August. So you see people coming, September, and just a few days ago. So thousands of people have arrived leaving the rural areas because there is no water anymore. But as you can see, there are many river courses over there. So if it rains, people will be washed away again. Nouakchott is another city which is under stress. And again here, I just want to talk about the celerity of the process. You see, this was 3 years ago. We are here at the beginning of June, and we have a tiny rainfall perturbation. And you see this area in the center that is totally void. And, okay, July, August, September, and then October. And this is just one of the little areas where people just try to survive, to go within the city. And can you imagine that over 100,000 people have come to Nouakchott just in a few months, but they don't have access to water? Of course, where do they go? But in the places where nobody wants to go. That is the river, the inside the river, where it's dry all the time, except when it rains. So these people are, again, extremely vulnerable to any change. Okay, another case study in Benin. Okay, so we are over there on the coast, and I'm not gonna say anything, except that this happens just in a decade. 2002, 4, 11, 13, and all this has been totally cleared because of the erosion, and this because of the authorities who destroyed the houses. So this is what happened in just a decade. So where did the people go? They just moved a few kilometers away, but still on the seaside. And just as Caroline Zigraf said, these are people that are affected by immobility because they have to stay there. And you see all those little dots, they are people living, moving. and they will have to move again because, as you see on the shoreline, they have to be displaced again because of the encroachment of the sea. So where are these people going? They're going on the lake, which is just a few kilometers from there. And this is a picture from 2002, and this is a picture from 2014. So people are just building on the lake. So clearly they are exposed to flood. And so every time we are in the rainy season, you can see this like gray line on this building. This is the level of the lake during the rainy season. And of course, those people are impacted by waterborne diseases during the rainy season. And the last example, very quickly, is in Haiti. It's not only an African stuff. And you can see here on the right, this is a huge mangrove in Cap-Haïtien, which is the second largest city of Haiti. But this has been cleared and people have decided to move in. But the problem is that the mangrove lies within this area where the water comes in twice a day. So these people are living in the mud. And of course, they are highly exposed to all waterborne diseases. Okay, field pictures, and when it rains or where you have a kind of a hurricane, sea level increases and everybody is totally flooded. But people also are living the inside of the country because of the erosion and drought and blah, blah, blah. And where are they going to build? They're going to build on areas that do not exist, but they create the areas, and they do create the exposure to risk. This is an example. You see the scale 200 meters. This is the mouth of the river that goes into the sea. And, okay, you see that people build on what? On garbage, on plastic bottles, on all these things. So they just put the garbages over there and they just build on it. And of course, we do have a problem with climate change. We do have a problem with people displaced. But we also have a problem with urban planning. And in this case, this is clearly a human problem. Thanks a lot. I just wanted to show some examples of the reality in the South.
Thanks, Dr. Oze. I think we'll be considering those images for a while. They'll stay with us. So thanks. Next, I'd like to introduce Mansour Desseh. He's the Director of Climate Change Negotiation Coordination with the Ethiopian Ministry of Environment, Forest and Climate Change. And he's going to be speaking about the impacts of El-Niño in Ethiopia.
Okay, thank you very much. I'm Mansour Desseh from Ethiopia. So I wanted to just highlight some of the impacts that are already experienced through the years of back. So actually, the previous speakers are talking about a lot of just climate change in different countries. So this makes me more to rush more in the subject matter, and actually I have also here just attained more experts on this just climate change in Ethiopia, just regarding to El-Niño, so they may also react on that matter too. So I want to try to start my presentation through the just highlighting the temperature change in throughout the eastern Ethiopia, eastern Africa, using the IPCC 2014 data. So you can see that here, just using different models, the temperature is observed, and just projected temperature is more increasing and increasing. So this creates a devastating impact in different, including health, different matters, so just related to human health, infrastructures and others. So I will try to, in the next 2 slides, I will try to see just climate of Ethiopia in terms of rainfall and temperature parameters. So climate change in Ethiopia with regard to rainfall just are highly affected using, just depend on the ITCZ, that's intertropical convergence zone, and again, most of you may know about Ethiopia. Ethiopia is the mountainous and highly ridged topography. That's this, movement of winds and other temperature parameters are highly affected by topography. So regarding to these 2 parameters, Ethiopia received 2 rainy seasons. That's a long rainy season, and again, short rainy season, is locally called cramped and bulk. Actually, these rains are just, rise from the Atlantic Ocean, and using, just with the help of Equatorial Westerly, and shorter one is just, Indian Ocean. You may imagine where the Ethiopia are located using the latitude and longitude, and going again, may locate longitude and latitude. So Ethiopia is found around the equator. So its rains is just affected using this topography and longitudinal and latitudinal location. So climate in terms of temperature is just, as you may see from the figure, that using the different researches, the temperature is rising at alarming rate. Just the yellow one is just observed one, and the green one is just projected one. Just you can say, imagine how much this temperature is increasing. You can see the average temperature increase within the 10-year space is 0.25 degrees centigrade. You may imagine how much this increment can devastating to human life and other issues. So I have already said that these drivers of climate change in Ethiopia is just related with ITCZ and just surface temperature. Just that's highly impacted by the temperature change within the Pacific Ocean or just the Indian Ocean, because we are Ethiopia just receiving the rainfall from these 2 sources of area. So this this ITCZ just oscillating across the northern Ethiopia, just within the July and August, and the most just down go into the southern Kenya in January and February. So this oscillation is, any slight change in the oscillation of this ITCZ will have an impact on onset and duration of rainy seasons. So at that time, if there is any little, divergence within the natural oscillation of ITCZ, will create a frequent drought. And this is more aggravated using, through the El-Niño southern oscillation. So you can see the sources like that. And these impacts of climate change are more aggravated with the resource degradation and overexploitation of natural resources within Ethiopia, not only Ethiopia, throughout the globe. So to highlight some of the impacts of climate change in Ethiopia, Ethiopia is just covered most of its land with the arid and semi-arid, that's a water-stressed area. So disasters are faced just directly linked to the adverse effects of climate change. So this variability of rainfall and increasing temperature was what I have already mentioned in the last, previous slides, is blamed to this change, disaster. So this actually leads to frequent major and dozens of local droughts and major droughts also. I will see them in next slide. And some of this one are already led the country to famine. You may see this, I don't know if maybe it's seeable or not. You can imagine the impacts of climate change in Ethiopia. Just you can see from the figure that from 1900 to 2016, using International Federation of Red Cross data and Actalians and OCHA, that's as a main source of this climate change impact with relate to the health case. So you may see the drought is the major. The drought is a major impact. I mean, just a major case regarding to the climate change. So you can see within this years, there are about 17 major events regard to drought, then dozens of local drought. So you can see also number of deaths is about 415,000 more, and again total affected you can see from the figure, and again in terms of money you can also see the figure. This also have, climate change also has an impact on epidemic cases. So this data, the above mentioned source of data shows that epidemics are the more and more linked with the climate change. And again, the other major impact is related to climate change is flooding. So the flooding can be, categorized under just flash flooding and again general flooding. So this is also the major impacts of climate change in Ethiopia. So as a conclusion, so Ethiopia's climate variability is just dominated by the El-Niño southern oscillation, and again frequent and intensity of drought project to be increased within the climate change, because in the above figure we have just realized that the climate change is highly impacting the inhabitants via the drought. So the projection of climate change is with regard to rainfall variability, and again increment of temperature is just increasing. So this impact will more and more severe in the coming years. So the trend analysis of past and future projection of climate change shows climate changing is just changing at alarming rate and associated with devastating impacts on life, biodiversity, health, and actually infrastructure regarding especially with regard to referring to the flooding. This is all about my presentation. Thank you.
Thanks, Mr. Messe, for sharing with us some of the impacts of El-Niño on Ethiopia, and in particular some of the future projections as well. Next is our last presenter. It's Dr. Joachim Rocklove, who is the assistant professor at Université. And he's going to, by Skype talk, he's going to discuss tracking displacement and the spread of pandemics with Twitter. So if we could get Dr. Rocklove up on the screen via Skype. We can see your presentation, Joachim.
Okay, that's great. So I hope you can hear me all right. It's a pleasure to join, although I couldn't join it. To present research on both El-Niño to infectious disease outbreak, but also specifically research on mobility displacement related to the social media explosion and the big data fields that we could sort of proliferate on in public health nowadays. So I'm at Université working on infectious diseases and climate change, and recently also on these social media. First of all, I wanted to show you some empirical data from Southeast Asia or South Asia on how strongly El-Niño events are affecting disease and incidence from arboviruses, Aedes-borne diseases, mosquito-borne diseases in the area. And we've been doing studies where we look at El-Niño. We don't look at El-Niño as a binary event. We look at the El-Niño index, the Ocean Niño Index, which is an indicator for sea surface temperature in the Pacific region. And for Sri Lanka and for most of the region in Southeast Asia, you can see a very strong association between the Ocean-Nino index and rainfall events, and also temperature actually, in Sri Lanka for a latency of 2 to 3 months. So after associated with a strong El-Niño, we can see considerable increases in rainfall in that region. And if we look at the association between rainfall and dengue incidents or dengue outbreaks, we could often see a very strong association. That association is a little bit less lagged, so there is a little bit shorter latency. We've seen strong increase after 6 weeks for the very heavy rainfall events. We also see actually a decrease for floods, and for very strong rainfall events, we can see a small decrease initially at the same time, but that grows into very strong increase later on after 6 to 8, 10 and 12 weeks. So if you look at the Ocean-Nino index directly to dengue incidents in Sri Lanka, we could see, based on this relationship with rainfall, El-Nino to the rainfall events and the rainfall to incidents, which is actually driving vectors, we can see a very strong direct relationship between the Ocean-Nino index to dengue and most likely other vector-borne, specifically arbovirus diseases in the region. The delay is up to 6 months, which is also providing an opportunity actually to preparing, because there is a lot of lead time before the epidemic would be so there's a lot of preparation time. More, I wanted to show when there is an outbreak coming, and we know that the conditions are going to be very suitable for epidemics. What can we do in order to prevent outbreaks to spread further? So at the local scale and at the larger geographical scale. So one strategy would be to use this type of geotagged social media information, and there's many sources that want to tap into to understand how people are moving around and what they are experiencing. So the social media is good in a way that it provides near real-time access to things that could be proxies or indicators for disease. Which is providing a real-time feed of what Twitter users are writing and where they are, and that allows us actually to follow these users over time and understand how they move around and how that can contribute to spread diseases. It improves our understanding of social networks. It provides time-sensitive estimates of mobility and also therefore of displacement for specific events, not for other events that we use in predictive modeling and for preparations. So one of the projects I'm working in deeply for where we want to bring this information into dashboard, a decision dashboard for local decision makers in middle countries, the WHO TDR project on early warning and response systems. And one of the futures, we haven't fully developed the aspect of the social media yet. The dashboard is working well in terms of meteorology and other factors, but the social media is under development. This is just showing the dashboard when we feed the Twitter signals into it, and we could basically present geographical locations of the tweets the last 15 minutes. As soon as you update, it's going to be a new set of data. So this is what we're going to work into early warning signals, together with meteorology, together with other information. I'm going to show you some examples on how that could be done. And that's based on results from Yogyakarta, Indonesia, where I've been working with my students. And we've been mining Twitter data for some time, and we've been extracting Twitter user and who's geolocated. And usually those are approximately 22,000 users in the city of Yogyakarta, Indonesia, which is a city of about 400,000 people. But not all of those users are frequent returning Twitter users in the area. So when we extract people that we could extract, where we can understand how people are moving around, we actually get down to about 1,000 users who are using these tools daily. And those we could start to understand what the social networks and what the underlying mobility, and if when you include time sensitive, you know, when you update mobility, the time is going to capture this displacement event as well. So basically what we do is we try to estimate the latent mobility structure in selected population, and that's actually represented by this blue matrix to the right, where we can see the probability of moving from each village in the city to another village, or each district in the city to another district. When we feed that into models and look into how predictive are those data to local, to outbreaks or to incidents in areas that haven't been affected yet, then we could describe that in terms of, for example, a correlation or a predictive model. Here we show it as a correlation. We show that when you combine mobility patterns of villages and combine that with the number of cases or the incidents in each of those villages, we can, for uninfected, for an area where there's not, we could understand and describe partly, at least, that risk of spread to that area. And together with other local factors, that is likely going to be much more important predictor than is shown here. But this still shows that for a lead time of 1 month and 2 months, there is very important information in this mobility network, and also in the displacement that we can incorporate into understanding the spread of the disease. And I mean, every outbreak is starting somewhere at the local level. So if we can understand how the disease is spreading at the local level, that is also going to help us to prevent the disease early, hopefully at the local level, before it spreads to become a global pandemic. And you could also start to understand a larger scale, you know, mobility and the spread at a wider scale. For example, what happened during the Zika epidemic and the travel of Zika across continents. So that's all I want to say. Thank you.
So we'd like to thank you, Dr. Rukla, for these interesting comments about tracking pandemics and with the use of social media. It's pretty interesting stuff. So we have time for maybe 1 or 2 questions. Sorry, time is quite tight. And then some concluding remarks. So is there any questions? Yes, go ahead.
My name is Sia. I am studying urban planning. So my question was... Sorry, can you use the microphone, please? Oh, yeah. My name is Sia. I'm studying urban planning at the University of Waterloo. So I noticed that some of the speakers mentioned urban planning as a solution to the displacement issues. And I was wondering if someone could elaborate on the kind of urban planning solutions that we could use to mitigate this problem and adapt for this.
Yep.
Well, there is one easy thing to do when it comes to urban planning, that is stop building cities on coasts. I think that at the moment, a key problem we're facing is that the number of people who live in areas exposed to climate change impacts keeps increasing, whereas it should be decreasing already, which means that the number of people in vulnerable situations keeps increasing year after year, which means that we're heading for a disaster. And the reason why this number keeps increasing year after year is because we keep building towns, cities, factories, and infrastructures on the coast in vulnerable zones. And of course, people are attracted by these economic opportunities. And of course, economic opportunities are a key driver of migration. So I would say that that would be the number one thing to do when it comes to urban planning. The second thing, I think, is to promote, adaptation in cities. Destination regions are often cities, and many cities are being overwhelmed by the influx of migrants. We see this in particular with the big cities in Africa, where many of them have a hardship to accommodate the migrants brought in by the rural exodus, meaning that these additional migrants cannot access the job market, cannot access decent housing, cannot access health facilities, and often live in very vulnerable neighborhoods, very often in slums. And therefore, they're moving from one vulnerable place to another vulnerable place. So there is a key stake in developing better urban planning strategies for cities in Africa so that they can accommodate migrants, and so that these migrant communities are also integrated on the transport network, on the job markets, and so on and so forth. Final point when it comes to urban planning, I would say it is to encourage the movement of people into zones that are less exposed to climate change. A number of governments have undertaken already resettlement process that is moving people out of harm, and sometimes forcibly, typically away from the coast or away from the riverbanks into the countryside. I think if we don't want to do this on a bigger scale, which will likely lead to massive human rights violation, it is important to encourage people to settle in zones that are less exposed, and therefore there is a kind of urban planning issue here when it comes to the geographical organization of the economy. And that would be, I think, the third issue.
Thanks very much.
Sorry, I've interrupted.
No, that's great. I was just going to say, unfortunately, we are a bit short on time, but maybe you can try to track down some of the panelists after the concluding remarks and, just try and ask them some of the other questions that you might have had. At this time, I'd like to welcome Nick Watts, who's Executive Director of the Lancet Countdown on Climate and Health, to come up and provide some concluding remarks.
That was for all of them, not for me. But I am left with the unenviable task of providing some concluding remarks from experts, sort of commenting on things that we've heard from experts who know far more about this than I do. More unenviable because I presume this is the last thing that most of you have to do today, which means that I presume you're either going to dinner or to the pub. If that's the case, don't worry, because I'm an Australian, and so you know that I'm kind of on your side when it comes to that. I want to go to the pub just as much as you do, as much as I've enjoyed your talks, please. Two things I wanted to reflect on. One that has nothing to do with this session at all, or is peripherally sort of related. I wanted to reflect on how fantastic it is that we had a packed room for this, how fantastic it is that when we take a look around all of the different health events run by the medical profession, by nurses, public health professionals, those numbers of events and the numbers of people attending and involved has grown exponentially over the last 10 years into something that's really quite impressive. It's happened because of the work of CVV, because of the work of the WHO, and many of the other people in this room, but it's important to reflect that 10 years ago when we held one event on health and climate change, there were like 6 or 7 of us in the room. And that's changed, and there are 10, 15, 20 this year, and a whole day summit on Saturday, and WHO events all day Sunday, and it's really exciting. Today, I think we've covered a lot of ground. We've covered a lot of ground, hearing and talking about sort of El-Niño as almost a test lab for what we should be expecting, or what happens when sort of the environment changes rapidly. Things that we are expecting more of in the future because of climate change, either sort of related to El-Niño or independent of that. We have heard about sort of the compounding effects of migration of some of these rapid shifts. We talk about it in sort of medical terms as the correlation of previously uncorrelated risks. When a population or a community is hit by 3 or 4 completely different health impacts that they weren't expecting. It's not just one, it's not just dengue fever or chikungunya, it's when that combines with malnutrition from flood, and when that combines with the mental health issues that you suffer as a result of these extreme events, and when all of those issues then sort of go forward to overwhelm a health system, and when sort of some of these events start to wear away at a community's adaptive capacity, at a health system's adaptive capacity. And some of these El-Niño events and the migration that follows, I think, is probably the prime example of what we're most concerned about as health professionals. It's that compounding effect. I'm not going to talk for too much longer. I just wanted to briefly touch on a case study. I have spent the last couple of days with a couple of colleagues from Peru who have been studying exactly this issue, looking at the impacts of El-Niño on health and how that's changing with climate change in Peru. And they have, I'm sure many people here know far better than I do, a particularly sort of pressing example, I suppose. Peru has experienced something they call a coastal El-Niño. So this is a 3-4 El-Niño, which is sort of particularly different to their normal 1-2. The numbers refer to sort of different parts of the ocean where the temperatures are rising. This has occurred mostly throughout 2017. And as a result of that, Peru has experienced 614 major flood events. So these are major national emergencies throughout 2017. Those 614 flood events have resulted in 691 mudslides, 238 landslides, 163 people dead, and 276,000 people injured or hospitalized as a result of these floods from El-Niño. It's damaged housing for 375,000 families. It's damaged 1,131 health facilities, rendering them inoperable for at least a week at some point throughout the year. It's impacted Peru's GDP by 0.5% of its GNP, and damaged 4,391 kilometers worth of roads. More relevant to this session, it's resulted in over 22,000 people displaced for at least a month throughout 2017. Many of those people still not finding a home after this. And there's a whole range of reasons why those numbers are so large. But when you go and talk to the government in Peru and you talk to them about the health adaptation plans that they have in place and the things that they've been doing and preparing for over the last 10 years and their best efforts, it's really quite impressive. They've tried and they've put in place some very impressive things. All of their best efforts, all of those systems were overwhelmed in 2017. And that's why 2017 was the highest spike of dengue fever that Peru has ever seen. That's why you get those 1,100 health facilities taken offline. What I'm trying to get at is that Peru, and I think the topic of this panel gives us a stark reminder of exactly why the health impacts of climate change or the health implications of climate change are so important. It's because of those limits to adaptation, because of what happens when you, like I said, wear away at community resilience, and you start to take this from something that's an environmental issue into something that's a humanitarian crisis. Anyway, thank you very, very much to our panelists. I don't know if someone is closing or if I'm going to lead the final round of applause. I'm going to lead the final round of applause. So with great energy.